All right. We are fortunate to get to spend a little time with Katie Comp today. Um, Looking forward to talking with Katie. This one is going to be not necessarily um, your typical accounting or finance discussion. We're going to get to talk a little bit about um, healthcare and how we can see the business side of that. So I'd just like to start with Katie, with you sharing about your high school experience.
Yeah, so I graduated in 2013. I played softball, basketball, and volleyball. I did Tri-High Y and medical careers. And actually, through medical careers, I did an internship my senior year where I worked half a day at Dr. Rudolph's office, Complete Family Eye Care. So,
Yeah, that health careers is really maybe what piqued your interest.
oh yeah, for sure. I knew I wanted to go into healthcare. I just didn't know what that looked like.
Mhm.
When I graduated high school, I thought I wanted to be an optometrist. And I got into college and quickly realized that 8 years of schooling and organic chemistry wasn't for me. Uh, so um, I realized that with my time at Dr. Rudolph's office, I enjoyed the people I was working with and the atmosphere of being in an office. So that's kind of what got me into the administrative part of healthcare.
Yeah, awesome. So if you wouldn't mind then to walk us through what your career path has looked like from graduating from Marion High School to where you are today.
Yeah, so I ended up going to the University of Southern Indiana here in Evansville, and I picked health administration. And I decided to do a couple of minors that set me apart from other health administration students. So I got a minor in accounting and business admin. There's a lot of budgeting and things, and it's really good to be able to understand those concepts as well. So I did two internships during my health administration path, and one of them was billing and coding. I worked for it was a third party company, and I just realized that was not for me. Sitting in a cubicle looking at numbers and claims, that wasn't for me. So I did an internship with St. Mary's. It's now St. Vincent, and it was strategic development. So we went around and we looked at different departments and how we could fund it better. What were the needs of our community, and if the hospital had this amount of money, where are we going to distribute that? So I got to meet so many different people, and I actually, when I graduated, I knew the manager that was hiring, and so I reached out to them. I was like, "Hey, I'm looking for a job," and so that kind of set me up for my career. Um, so I graduated college, and I was looking for a position. I had a degree, and health administration is one of those really broad degrees. You could do so many things with it. And I had heard, you have to work up the ladder, you have to kind of make a name for yourself. Well, I didn't really understand what that meant. So I started out working front desk at a doctor's office. And I was very upfront with my manager, said, "Hey, listen, I don't want to be in this position long. I'm going to work my butt off. I'm going to challenge myself. I want to be your go-to person so that when an opportunity arises for a manager position, I'm the first person you think of." So that's how I got into my current role.
And what is your current role? What do you do on the day to day? What does that look like?
Yeah. So I'm an administrative coordinator. I have two departments. When you think of a hospital, you think of like the actual hospital where you're having babies, you're having surgeries, but there's another component. It's called the medical group. So that's your doctor's offices. And so I have dermatology and the sleep center. I have roughly 30 associates that I manage. So what that looks like is when I start off my day, as anybody called in, I'm covering for that. I work a lot with the workflow. So especially when I started, making sure that your front desk, reception, and your clinical staff have really good communication. We have a lot of metrics that we have to meet, so making sure that our patient satisfaction is above 80%, and we have these check-in pads. They're called freesia pads. We have to have a certain amount of usage each week from each department, above 80%. So I have productivity. So part of the sleep center is the sleep lab. So we're looking at productivity. If somebody calls off or if a patient cancels off, I have to call a staff member off, making sure that we're remaining very productive in all of our work. So it just depends on the day. Right now, it is very fluid. We've got things changing every single day. But it's a lot of making sure coverage is taken care of and the workflow is operating correctly and schedules. Every provider is different. Every provider has a preference on what their day looks like. Communication from the provider to the clinical staff. It's everything. So
that sounds like yeah, your days can look different just depending upon what's going on or what fire has to be put out, that kind of thing.
oh, exactly. Yeah.
And I think it was so smart of you to pick up those business classes as minors, to really give you even a better foundation. You know, that was really wise. So I send everybody this kind of the same list of questions, and I didn't put this on here, but I'm going to go ahead and ask it. And if you don't want to answer, you
Okay.
don't. But
No
how
problem.
has everything with the coronavirus impacted what you do, or kind of what's going on around you maybe?
So I tell everybody right now, I'm here for moral support. So everybody is up and down. We're freaking out, and then we're fine, and everything's normal. So it looks a lot different than our normal day. So I've got a bunch of pulmonologists that work at the sleep center. So they're at the hospital taking care of these patients. So it's moving patients off their schedules. We're moving to virtual. So right now, all of our patients are virtual appointments. So that means calling the patient, telling them it's a virtual appointment, filling out paperwork over the phone, which can be so difficult because patients have been home alone. They haven't talked to anyone. You're the first
Mhm.
interaction you have. So they want to spend a bunch of time. And then getting the providers to operate technology, which has been a lot in and of itself. And then just making sure that no patients are falling through the cracks, that our high risk patients are still being taken care of. For dermatology, we're still doing surgeries. It's considered a procedure that we can still do. Skin cancer grows so quickly that we like to take care of those quickly. So it's the patient walks in, we send them right to a room. They're not in the waiting room at all. So it's very fluid. Every single day, I have new updates. I have 2 or 3 calls a day to give us updates. The PPE shortage, we're constantly being updated on what that looks like. So every day is different, and it looks so different than our normal day. And you just kind of have to figure out your new workflow and go from there. So.
Has PPE been an issue where you're at, or are you doing okay in Evansville?
Yeah, so we're St. Vincent, which is a part of Indianapolis. So we have a lot of resources coming from Indianapolis to Evansville. So we really haven't experienced it on the medical group side. We're about to go into phase 1 of bringing patients back into the office. So it's been a lot of does the staff get masks? Does the patients get masks? Making sure we're wearing masks and gloves and cleaning things off. So we, on the medical group side, we really haven't seen that be an issue. But as we have more patients coming in, I think that at least the masking is going to be more difficult.
Okay, gotcha,
Yeah.
gotcha. Well, so you have gone through a lot of ground, a lot of information for us, and I appreciate you taking time in light of everything that's going on to share with us. So just kind of parting final words here. What advice would you give to someone who's a junior or senior in high school that might be watching this, or what would you have liked to have known as a junior or senior in high school?
Yeah, so I guess first of all, you have to identify what success looks like. When I graduated, I didn't when I graduated from high school, I had no idea what working your way up the ladder meant. I didn't have a career that I wanted to do since I was a little girl. I had to kind of find that path, and so that's why I did do a couple of minors. I tried some classes just to make sure that's what I wanted to do. So making sure that success to you means it's setting your heart on fire, that it's challenging you. And you don't have to be in one place for very long if you don't want to, but you gotta try and make relationship and networking. I would say networking has been the biggest opportunity for me, and being very vocal with your managers and the people around you that, hey, I don't want to be stagnant. I want to be challenged. Give me all the things and I'll do them and I'll do them well. And I promise you that that will take you far. Um, my manager now, we're looking at opportunities for me to grow. And I don't think that's a bad conversation to have. So identify what success looks like for you. If it's just fulfillment, if it's, money, that's okay. But I think success to me when I graduated high school was I've got to be a doctor, a lawyer. You know, there's so many occupations out there that you don't even realize are there until you get into the workforce.
That's what I think is has been the best part about doing these interviews, is just learning about so many different avenues that are
Mhm.
out there. I mean, in high school we touch on the very broad things,
Right.
and then it's neat to see people become more specialized as they go along. um,
Mhm.
and it's really neat to see there are, and I talked to one student, a former student, about the fact that some of these careers weren't even around. When you were
Right.
a kid, when you were in kindergarten for career day, you wouldn't have thought to even say, I want to be in healthcare administration, like.
Right.
So I think this is a great opportunity for our students. And I think you're so accurate when you say it's important to figure out what you enjoy and what is going to set your heart on fire.
Mhm.
That's a really good piece of advice.
Yeah.
Well, Katie, thank you so much for doing this with us. Please stay safe. And
Yes.
um, if, not if, when this is all back to normal, I would love for you to come and talk to my principles of management class. I think they would really enjoy hearing about what you do.
Absolutely. I'd love to.
All right. Thank you.
Thank you.